Good afternoon, everyone. Thank you so much for joining our Virginia P3 Grantee Resource Session. As we begin, we first thank you for joining. As we begin, we're going to have some housekeeping as regular. Uh, Making sure that you are aware this session will be recorded, that you will receive this copy of this recording, and also it will be posted on our VDH Office of Health Equity website as well. All participants, your lines are muted. For questions, please use the chat box and or raise your hand. Closed captioning is available. Please use your Zoom instructions to follow that guidance if needed. Again, please introduce yourself in the chat. Let us know where you're coming from, what organization you're representing and where that location is. Will be greatly appreciated. And not to belabor the time, want to definitely introduce you to our team. I am Veronica Cosby, Program Manager of Virginia Partners in Prayer and Prevention. Through our program, we work with our FBCOs, our HBCUs, our HSIOs. Many of you are very familiar with Jasmine Martinez, our outreach coordinator, who is handling the technical support of the Zoom today, but then also Kiana Richardson and Richard Seafront, which are our project coordinators for our HBCUs and our HSIOs. So with that being said, we team up to have this event. So you're gonna see a little bit of everyone engaged in this session. Next slide for me, please. So it is a great opportunity for you all, and it's great to partner with another agency. We say DMV, but the Virginia Department of Motor Vehicles. It is a pleasure to have Rebecca H. Overman here, our Virginia Highway Safety Officer, to discuss our Road to Safety Virginia Department of Motor Vehicles grant opportunities. Again, grantees, these sessions are a resource for you, as you're working on the community level, as you're working directly with community groups and safety. We talk about reducing health disparities. Reducing health disparities applies in so many areas as we talk about our public health, and making that connection, and how we can be engaged in addition to what we are doing, but also how the work that we're doing can be encompassed in some other agency opportunities. And this is one of those opportunities. And so I'm not going to belabor the time, but I will say this. Rebecca, you have a great group that you're speaking with today. And we welcome you and your team who's on this call. I see, like I shared, you have some of our HBCUs on this call and FBCOs across the Commonwealth. So we welcome you. We are excited to hear about what DMV is doing and how we can connect. So I'm going to pass the baton to you now. Thank you so much for you and your team joining.
Thank you, Veronica, for that introduction. I am very excited to present this information to you because I started in highway safety and learning about new information, and this is just one of those things that I have come across, and I am happy to provide out the education and information to others. So let me get this presentation started. Hold on one second, and I'll get that screen up for you. Oh my. Okay, let's see what we got here.
I guess you need me to pull it up. I got it.
I'm sorry. Let's see. Want to share? Oh, okay. Can everybody see my presentation page? See. Great. Is everyone seeing the presentation page?
Yes, we are. Yes, we are.
Okay. I have the amazing opportunity to support our law enforcement officers who serve the Richmond region, which stretches from Louisa County down to Mecklenburg County and from Buckingham County over to Prince George. Here's a brief look at what we will cover today. Introduction. Highway safety in Virginia. Are you eligible for a highway safety grant? How to apply for a highway safety grant? Examples of current projects or grantees. And of course, we'll conclude. Many of you may not know much about Virginia Highway Safety's office. Our office is part of Virginia Department of Motor Vehicles, and we focus on preventing deaths and injuries on Virginia roadways. Part of that work means that our office maintains the statewide crash records in our online traffic records electronic database system known as TREDS. We will talk a little more about that later and how it can be a resource for you. The data from that system helps us to understand where we need to focus our resources as an organization, whether that be on a topic like preventing drunk driving or on a specific town that is struggling with an increase in pedestrian crashes. Naturally, our office alone cannot do all the work needed to help keep Virginians safe on the road. We get to work with community leaders like yourselves to make a difference in the areas they serve. The Highway Safety Office provides grant funding for state and local law enforcement, state agencies, institutions of higher education, and 501c3 nonprofit organizations serving Virginia with transportation programs. There are many different areas our grantees focus on that I'll go into in just a moment. But the key is to use what you know about your community to determine how you could best help them create safer driving habits. Our grantees cover topics that cover everything from encouraging cyclists to wear helmets to help guardians choose the right child seat for the tiniest passengers on our roads. Using the data we can find in our TRED system I mentioned before, our office identified 5 key areas of focus for the upcoming grant year: pedestrian safety, motorcycle safety, speed prevention, and preventing drunk and distracted driving. But this does not mean those are the only areas open to funding. Let's look at a few areas that may connect with your congregation or communities. Preliminary numbers from our crash database show that in 2024, 315 people died and over 1,000 were seriously injured in crashes as a result of not wearing their seatbelt. There were 673 crashes involving a bicycle, 152 drivers over the age of 65 were killed in crashes, and 741 were seriously injured. There's no doubt that those are sad statistics I share with you, and chances are your community was touched by one of those crashes. But you are uniquely positioned within your communities to help your communities in changing their behaviors to save lives. As community leaders, you are trusted and your opinions are valued. If you explain to your community why it is so important to buckle up or wear a helmet when you ride a bicycle, or offer a ride to community elders when the roads are slippery or when it gets dark super early, people are more likely to listen. Your opinions and your voice matter. Our grantees, folks like you, are the real boots on the ground. We provide the funding and we are always around to provide guidance and support, share tools, and help problem solve if you run into roadblocks. We also oversee the grant progress. Check and see if the program is meeting goals and using the funds wisely to make sure we both stay in compliance of the federal funding. So now that you understand a bit more about how we can help your community, let's get into the logistics. As I mentioned before, to apply for a highway safety grant, you have to be a state or local law enforcement agency, state agency, institution of higher education, or 501c3 nonprofit organization serving Virginia with a transportation program. The project or program does not have to already exist. If you can create a plan for a program and show how it will address highway safety issues in your area, you can use grant funds to start that program. Here are some of the big picture details about the grants. Our grants are on a federal fiscal year that runs October 1st through September 30th. Our grants are reimbursement grants with a minimum grant request of $5,000 and 25% match. We'll get into that in a little more detail later. You will need to report back to the Highway Safety Office on progress and reimbursement needs. Progress reports are done quarterly. There are site visits conducted by the assigned program manager. Voucher reimbursement with supporting documentation is submitted monthly or quarterly, depending upon which is selected. All these ensures that we stay up to date and that everyone is meeting all the requirements needed to maintain that funding. Organizations interested in applying for a grant are required to complete the virtual grant application training workshop. The virtual workshop will be available on February 1st, and applications must be submitted before February 28th, 2025. At the end, I will have a slide with links and contact information if you are interested in applying. To put your best foot forward with your grant application, you will need to show that you have planned an effective program or project. This must include measurable objectives to evaluate the success of initiatives. Funding will be awarded based on the potential impact of the proposed projects based on these performance objectives. So, how do you plan an effective highway safety program? First, you have to identify a problem. What dangerous driving or pedestrian or cyclist behaviors are impacting your community? Talk to your community and see what they think the problems are. Make sure you do your research, and if you see someone else in your area is already focusing on the same thing, make sure your idea is different and addresses an area not being specifically addressed by another organization is what will help ensure that you make the biggest difference in your community. Get data to support. Use tools like TREADS or local agency crash data. Does this data show that many of the crashes in your area involve drivers or passengers who were unbuckled? Remember the crash database TREADS that I talked about earlier? Let's take a look at how it could be helpful. Let's say you serve the community of Ashland and you know people drive way too quickly through town, despite the train tracks and frequent pedestrian traffic. We can go to DMV's website and pull up our statewide crash data and look at the town of Ashland and speed-related crashes for the past 4 years. Keep in mind that 2024 is still preliminary. What we see is that speed-related crashes have gone up since the low of 28 in 2022. So you could use that data to determine how you could help inform your community about the dangers of speeding with the goal of getting speed-related crashes down 5% from the 34 in 2024 by the end of the FY 2026 cycle. That's the next, how to apply. That's the next step. Identifying goals, objectives, and tasks. So once you have identified your problem and have the data to support it, you plan out your ultimate goal. In our example, it was reducing speed-related crashes in Ashland by 5%. And from there, how will you achieve that goal? What are your objectives and tasks? What are the steps you will take to get there? These goals, objectives, and tasks need to be SMART. And what that means is they should be specific, measurable, attainable, relevant, and timely. Like our Ashland example, we were specific. We had a measurable outcome that was attainable. We aren't aiming for 0 crashes in 1 year, and it was timely by the end of FY 26 cycle. Now to the money part of the grant, budget and cost sharing. As I mentioned, our grants are reimbursement grants, meaning that you will expend your organization's funds and then seek reimbursement from the grant funds. The grants have a minimum request of $5,000 and no maximum. The grants require a 25% match from your organization. The match can be monetary or an in-kind match, such as fuel and maintenance or volunteer hours. There's a section to fill out personnel needs. including allowances for indirect costs such as fringe benefits. And of course, there are things that are not allowed, such as the cost of construction or promotional items like keychains. Once you have completed your application online, it will undergo a review process, during which you may be asked to come in and share with our grant committee more details about your proposal. This is by no means an extensive explanation of the application process and details, but if you are interested in applying, I'd be happy to provide you additional details and contact information. No, that was a lot to take in, but I really want to focus on the identify a problem piece of this puzzle. Is the first step is to decide how you can make a difference and how your idea is different. Some of the questions you can ask yourself are, how can I help keep my community safe? What does my community need to hear to stay safe? To help get some ideas flowing, I'd like to provide some examples. Here are some ideas of grantee programs you may find helpful. Teen driver and seat belt safety. The Christopher King Foundation is a nonprofit organization dedicated to promoting safe driving practices and emphasizing the importance of buckling up among youth. Founded by Christy King following the tragic loss of her son in a car crash, the foundation is committed to preventing similar tragedies. Through educational programs, awareness campaigns, and community outreach initiatives, the organization works tirelessly to educate and empower teens to make safer choices on the road. Impaired driving. Substance Abuse Free Environment Incorporated, SAFE, is a coalition in Chesterfield County committed to changing behavior and attitudes towards impaired driving in communities, reducing the number of lives lost on the roads due to impaired drivers. SAFE used grant funds to prevent drunk and drug driving by developing and implementing a video series about impaired driving, including the zero tolerance law, social media posts, radio segments, and community outreach presentation and events. Child safety seats ballot health addresses child passenger safety challenges in Southwest Virginia by supporting low-income families in rural areas. Through grant funding, the program provides car seats, safety education, and seat inspection checkpoints directly to those in need. By partnering with local health departments and increasing the number of trained technicians, Ballot Health is improving access to resources and enhancing child safety in underserved communities. So let's share some ideas that could work if you work for or with a church community of faith to get your ideas flowing. You could start a street safe kids program to share with the kids in your community or congregation education and training on how to safely cross streets, safely ride bikes, and make sure they always buckle up. The goal could be to reduce crashes involving individuals under the age of 16 by 8% by a specific date. You could hold a series of classes on preparing for parenthood and focus on educating young families in your community or congregation on the importance of child passenger safety and what safety seats are right for their child and their vehicle. Often, individuals who don't feel safe driving do so because they simply have to get to the grocery store, and they could be putting themselves or others at risk by getting behind the wheel. You could aim to reduce crashes involving those over 65 by organizing volunteers to help get the older community members who no longer drive or who should no longer drive to doctor's appointments, grocery store, or pharmacy, assisting with gas mileage reimbursements for volunteers with grant funding. I hope that during this presentation, you're able to think of ways that you can make a difference in your community through highway safety. And if you feel this might be the right fit for you, we would be happy to help. On the slide, you'll see a link to our contact information. Hopefully, we can make this presentation available to you so you can review it. Also, we would love if you could take the survey at the end of our time together. Now, I'll pass it back to our host and we can open things up for some time for questions. Thank you.
Thank you so much, Rebecca. But I'm gonna pass it right back to you because I would like to know, and I know we're opening up for questions, but as we're talking about how they apply, can you kind of maneuver through your website to direct us to where they go to apply for the grant opportunity and other grant opportunities if that's available? So if you can share your screen, that would be a great guidance for us to say, oh, okay, and I will say thank you so much for sharing a data tool because very important is that when you do have a problem, you have to show data to support that problem, those efforts that you're looking to address in your program. So if you can just maneuver for us through your DMV website to share where we can locate the grant opportunities, and I know you can't go into the portal of how you applied, but show us where. That would be helpful. And while Rebecca is doing that, if you have any questions, please use the chat. Or you can raise your hand and we will unmute you to ask your question. And then also, if you have not introduced yourself in the chat, please introduce yourself and what organization you're representing, please, in the chat.
Oh, let's see. Oh, okay. Okay. All right. All right. Okay. All right. Can you see the DMV homepage?
Yes. Yes.
Okay, great. All right. So you're going to visit this homepage here. And to find highway safety information, you're going to see this link right here, safety. You're going to click on that, and that will take you directly to our highway safety information here. Several things that are listed in here. There's a lot of information here. There's access to statewide crash data here. It will give you several different tools that you can look at to locate and research the data you're looking for your specific area. There's also, it gives a lot of different links here as far as our highway safety information is concerned there. Okay. So that'll cover the safety data. And I'm sorry, I'm going back here. This is our grants management. So this is our grants management page. This will cover information as far as what types of grants are available. Now, for state nonprofit higher ed, it is going to be a little bit different as far as how you apply. And if you email us in with that contact information, we can get back to you. In the presentation, there's a workshop that you would need to participate in uh, to gain information as far as that is concerned. But this will give you a vast majority of information here as far as what types of grants are available. And we can help you if you contact us, to get you pointed in the right direction. Contact one of our program managers that is listed there, Beverly and myself. And then, of course, all of our office staff would be able to help as well. There's also a lot of resources and information, contact information here as well. I know my contact information is in here. As far as the highway safety information, we cover the whole Commonwealth. So this is just a little bit of what I cover here, but it's a lot of information in here as far as this is your resource to go to if you're looking for highway safety information and what is happening here in the Commonwealth and what we're doing and what numbers are showing and how you can help as far as grant application and applying to help drive the number of fatalities down. Because what we're looking for is getting the education and information, trying to change the behaviors. And we can't do that alone. We need your help. We need others to be a part and work together to do this, because we can't do it alone, and nobody can do it alone. So we have a lot of programs here focusing here on bicycle safety, child safety, child seat safety, impaired driving, mature driving. There's a lot of information on this website, and this is how you get to it. You just go to the Virginia DMV website here. So, and this is where you're going to find how to contact us and so forth, and other resources that are available. So I hope that helps.
Yes, that definitely helps, Rebecca, because as you were looking at and sharing the page where the programs are, very instrumental to how our grantees can actually see what the work that they're doing and how they can be incorporated in some of these, correlate with some of the programs that you are offering.
Right.
I have a question off the bat. I don't see any questions in the chat box. However, for those that are participating on the call and those that may not be participating on the call, but this recording, this recording will be made available for them. I do remember you saying that there is a minimum of 5,000 for your grant request. However, there is no maximum, but then I did see that there is a 25% match. Correct.
That is
Okay.
correct. Yes. It is. Yeah, as you know, it's stated there, the lowest is 5,000, and there's no maximum. But I mean, of course, you're going to do your research to find out what you're going to be looking at, to determine your budget. You don't want to request too much, but you don't want to request too little as far as when you're applying. So it's good to find a good medium to start off in your direction, as far as what you want to do. Okay. And then of course, there's the matching, the 25, it's 25% for the nonprofit, state, higher ed on that side. So that, whatever you spend, they'll match it by 25%.
Awesome. Awesome. Thank you so much for that response. We do have a question in the uh, chat from Miss Dickerson from Virginia State University. Um, no promotional items or capital improvements. Are food items and non-alcoholic beverages for participants allowable cost? And that's more so if they were having something, a specialty event or a series of sessions for participants. And these things may happen after work hours or in the evening. And given that during that time, it's in a spot where it's after work or before dinner,
Right.
are those things allowable? And
I'm
I'm
going.
hoping I'm correct when I'm
That's
answering
okay.
this question. Yes, ma'am.
That's it. Since I work with the law enforcement side of it, it's handled a little bit differently. So I'm going to see Beverly, Kimberly. Do y'all have? I know a couple of my coworkers are on here. We have Beverly Copeland from. She's our state nonprofit higher ed program manager, and then our deputy director, Kimberly Burt. I believe she's on here as well. Beverly, Kimberly, do y'all have any input? It won't let me unmute. Hold on one second. My deputy director, Kimberly Burt, just came into my office.
I do apologize.
Good afternoon, everyone. I was unable to unmute myself. When it comes to meals and foods, if it's part of a conference, and a registration process, food items would be allowable along with the alcoholic beverages. If it's just, say, a meeting, that's something that would have to be looked at a little differently because there are parameters on what type of event. If it's a registration process, the link, the agenda, that will come into play when it comes to food items and non-alcoholic beverages.
I will say, and thank you so much for your response because I know with VSU they not only do programs on campus but also in the communities where their community members that they do programs with, they do register, and it may be a series of events that they do support. And Ms. Dickerson, if you wanted to, we can unmute you if you would like to share a little bit more detail on that, or just provide a little bit more explanation. You can unmute yourself.
Oh, thank you.
You're more
Good
than welcome.
afternoon, everyone, and love the presentation. This is the first time I've learned about this grant, so very excited. But yes, Ms. Cosby is correct. I do know that we have a few grant tours that food and beverage they're not permissible. But a lot of our workshops are with various groups, and that's kind of the incentive. So once the promotional items were kind of not allowed, I just wanted to know if we were able to kind of recruit them or reward them in that type of manner, but it would be during a workshop or a session.
What we would look at specifically at that is the length of that particular event. It would have to fall under the state travel guidelines and procurement process. But I don't want to completely say no because it's something that we would have to look into. Community engagement and collaboration is a big part of what we're doing now. So there may be some opportunities to expand to be able to provide snacks or food for those type of events.
Awesome. Awesome. If we do we have any additional questions in the chat? And then also you can use the raise your hand feature, and we can definitely unmute you. And then also I will make it so please that you can actually unmute yourself if you have a question. And so with that, as we are having questions and talking during this time, it's conversational because many of our grantees that I see on this call not only have worked with seniors, that have worked with youth, that have worked with many community groups in their area. And so, how do you uh, implement these programs? And so, I would like, if possible, I do have a few grantees on this call, just to share a little highlight of maybe some of the programming that you've done. I don't want to call out names, but I used to be in school administration, so I'm just letting you know. So would like to highlight some of the programs that you have had. And Rebecca, please give us some insight to how we can maybe engage those groups or programs that we already have that could parallel with this funding.
Right.
And so I'm going to call out a name if you don't mind. Dr. Pass, how are you doing?
I am fine. How are you?
Your style.
Hi,
Would
everyone.
Would you like to share some of the work that your group, your program has done, and how Rebecca can give some insight to how some of these programs of funding can implement or can be implemented in what you're doing, Dr. Pass?
Yes. Hi, everyone. I am Dr. Tanya Paz, and I am the CEO of You Need to Know Ministries and the senior pastor at Brighton Rock AME Zion Church in Portsmouth. And our signature program is our after school mentoring and tutoring program. And from that kind of spins off a lot of what we do. We provide, of course, the after school mentoring and tutoring. We bring in other partners in. This past year, right at Christmas, we had a partner that came in and they donated helmets, safety helmets for our children when they were riding bikes. A lot of our children, they walk. So I was looking at this grant, thinking about the pedestrian piece of it would be very helpful. A lot of our kids, they do walk to the center. And also, we've had a grant through the Virginia Department of Health to help in terms of the COVID-19. And we did a lot of things during that time, was during the pandemic, and we did a lot of things virtually. So we had some educational online forums where we did that as well. And so we do community resource fairs, health fairs, and we have community partners to come together and we share information. And so I was thinking about this particular grant and how I would be able to utilize it. Certainly, it could be one that we would teach our youth as well as their parents, um, and maybe even doing something virtual as well in terms of the education, because we have our online presence as well, and that does help as well. So if you could think of anything else, please share.
Well, yes, I'm definitely the education and information out there. But you're gonna want to look at, is there a problem in the area with pedestrian safety? You're going to look at that information and build
Okay.
on it, because that's what you're trying to do, is reduce that number of fatalities of pedestrians. So, working with your education and information, then that's what you want to look at, the key numbers, and then bringing those pieces together. So yes, absolutely. That's, looks like it's headed in the right direction. I can see a lot of possibility there
Yes.
for, information getting out. Kimberly, do you have anything else to add? Question?
I do, yes. Thank you, Rebecca. Perfect answer. And Dr. Pass, I love that you're the audience for the Ped Bite, but I think there may also be a potential connection when we talk about our young drivers, our teen drivers. I'm not sure the age group that comes to your particular center, but I think that may be an area that you could tap into and look at the data as well, because of your audience. Ped Bite definitely, teen drivers. I think that may be another opportunity for you to look at the data to see what's going on in your area as well.
Sounds good, because we do reach the high school as well.
Mhm.
That's what I thought. So yes, I think that will be another perfect opportunity for you.
Yes, thank you.
There's a lot going on there. Absolutely. I can see it. And that's very exciting. Thank you for what you're doing.
Awesome. Thank you so much, Dr. Pass, for sharing. Mr. Morgan, you can unmute yourself. I know your hand has been raised. Please share with us.
Good afternoon. I hope you can hear me.
Yes, we can.
Uh, our Empowerment Center for Children, Youth, and Families in Norfolk was favored with funding from the Partners in Prayers and Prevention, and part of that we used for safe routes to school, bicycle safety training in conjunction with the Norfolk Public Schools bicycle facilities and the League of American Bicyclists curriculum for youth cyclists. So we've done that for a couple of summers and had good success with children learning how to ride safely, age-appropriate riding, how to ride, across streets in traffic. And we usually get about 10% of our students that have not been able to cycle to be able to learn. So that, who hadn't had an opportunity as they're growing up, some actually teenagers. So I'm thinking that safety might be a provision that the transportation safety funds could help. We have had a fair amount of bicycle fatalities and accidents in the city of Norfolk. Also, we have community fairs that I believe would be a good venue for the child safety seat, best practices sharing. So would that be worth an application consideration?
Did you have anything you want to add?
Yes, based on what you're saying, I think that could be potentially a good project or program as well. Pedestrian fatalities and I think that's what you said, pedestrian or bicycle has been one of our priority areas. They're one of our strategy areas. And over the last several years, we have seen an increase in pedestrian fatalities. Preliminary data for 2024 is still coming in, but I can tell you as of today, when we're looking at pedestrian, this is just preliminary data that I'm going to share, that looking to date at pedestrian fatalities compared to the same time frame in 2024, we're already up from where we were last year this time, which is quite alarming when we are 14 days into 2025 and we're already seeing an increase in our pedestrian fatalities compared to the same time period last year. So when you think about pedestrian and bicycle, they kind of go hand in hand. But anything that we can do in that area as far as programming and projects, we're always looking for opportunity to expand.
Thank you. Thank you, Mr. Morgan, for sharing. And also, Kimberly, while I have two of our HBCUs on this call, Norfolk State and VSU, I just think about a lot of our upcoming freshmen that are just coming on campus. A lot of on campuses, there's a lot of commuting. There's a lot of moving around, of course, during the day and in the night, and potential sessions or a series of sessions that could happen on college campuses in regards to education. And that includes in regards to not only safety, but in also as we think about activities that our students are having on campus, and whether or not you should be driving after some of those activities. And those things are just come to mind as we do have that representation on the call, both Dr. Burwell, and then also I'm about to say Dr. Dickerson, so I send that to you. If either would like to highlight any areas that the on campus that they have done some safety, or would this be something also that again that they can chime into for students as well, not only that are on campus but are external to campus that have to walk, and many of these schools are in communities. So just sharing that as well. I think this is a great opportunity to share and just to get your feedback. And Kimberly and Rebecca, I just appreciate you being on to answer the questions. And so I'm not sure if there are any additional questions in the chat. If anyone else would like to unmute themselves.
Veronica, I do want to
Yes.
say real quick that we currently have a project with Norfolk State University Foundation. And they've been a partner of ours, I think, for FY24. I can't remember, it was FY23, but we have had a great partnership with Norfolk State and pushing out of some of our highway safety message. They've been doing a phenomenal job, and we're excited that they're on board with us again. In addition to what you're talking about, the impaired driving piece of it, reality is they're out there drinking and driving. But another big piece that we need to educate on is seatbelt use.
Yes, yes, yes.
Seatbelt use is a major issue. About 50% of our fatalities are unbelted. And believe it or not, those that are unbelted are our males. So that is another key area of focus that we can educate and get messaging out that I just wanted to mention.
And
Yes, I was,
Dr.
I'm
Burwell,
sorry.
yes, ma'am.
I
No,
was going to
Dr.
say
Burwell.
that that piece with the seatbelt safety has been highlighted at all of our home basketball games, all of our home, sporting events. And to see that statistic come up and it says that, over 50% of the fatalities that come from people not wearing seatbelts are African American. That's like, oh my gosh. So yeah, we have seen that in action. Yeah. Now you all talk about alcohol related driving. Um, has anybody done anything with marijuana?
So we do have some projects that are focusing on drugs. That was just really one of the program areas that came up where we do have funding for that. So we do have a project, but that's more specific for a group in the Richmond area that has funding. But that is something that we can fund. Drugs is a part of an impairment. When we talk impairment, there are 4 Ds: drugged, drunk, drowsy, and distracted. So drug is an area that is allowable for funding. So we're seeking projects in that area as well.
Thank you.
Thank you. Awesome. Awesome. Um, if we have no further questions, I see that, oh, I do see Miss Elder Arnold is on. Um, Ms. Arnold, would you like to share in regards to some of the work that you're doing in the Richmond community? Because I did just hear Kimberly say that there was, in regards to some specific, in regards to substance in Richmond. Would you like to unmute yourself to share about the work that you're doing?
Hello, everyone. I do apologize. My camera is not working today, so I do apologize. But we do a whole lot of different community fair events, health fair, and a lot of educational awareness. We do work with anywhere from elementary up to high school. We have a big community event that we do every year that we have different partners come in where we do health checks, safety checks. We give away about 250 pairs of tennis shoes, back to school supplies, coats, and it's a way to get the families and the kids to come out to the event. But once we have them there, we talk about all kind of issues that they need to know about before going back to school. It's any type of safety, substance abuse, and drinking and driving. That's definitely one of them. And we definitely have a summer program as well that we do that focuses on substance abuse. And then we teach them different skills and stuff that they need with considering like drinking and driving, using marijuana, all different types of drugs, just giving them safety mechanisms and different things to think about so that they won't use those things. And that's just a little bit. So we do a lot more, but that's just a little bit.
Thank you so much, Lisa, for sharing. And I thank you all for the opportunity just for being here. I'm going to turn it back over to Rebecca and Kimberly. Would you like to have some final words before we close? If there are no further questions, um, would you like to have some final words before we close?
First, I will say thank you for the opportunity for DMV and the Highway Safety Office to have this opportunity to share information on our highway safety grants. I specifically want to thank Rebecca for the awesome job she's done in presenting the information today. We're always looking for partners. If you may not want to apply for a grant, if you are looking for opportunities where we may can come out and be one of your exhibitors or present at one of your events, that's always something that we can take and present to get approval for as well. If you just need data, you have questions, feel free to reach out to us. Again, we're big now on community collaboration and community engagement. And I tell people, you may not be directly involved and you didn't know about this, but it's a perfect opportunity to learn more about highway safety. The number of people that we're losing every year on our highway is just unacceptable. People say it's an accident, but these are crashes. They are preventable. Um, a speed related fatality is preventable. Just slow down. An unrestrained fatality is preventable. Just buckle up. An alcohol impaired fatality is preventable. Don't drive while drunk. So there are crashes. They're not accidents. Everything is preventable. We are really pushing highway safety to probably one of the highest levels we've done in quite some time. You've probably seen many of our ads that we're doing here locally. You may have seen the recent pedestrian campaign that You're Not a Duck. So again, thank you for the opportunity. If there are any questions that you may have, feel free to reach out to Rebecca or myself, and we will be able to find an answer for you.
Thank you so much, Kimberly and Rebecca, for joining us from DMV. To all participants, thank you so much for taking out the time out of your schedule to join us. As you know, this is a recorded session, so the recording will be made available to you and all those who registered, along with the PowerPoint presentation provided to us from Rebecca. If there are no further questions, if there are no further questions in the chat, again, we thank you for joining, and also Happy New Year. Blessings to you this new year. So thank you and have a wonderful remainder of your afternoon.
Thank you, Veronica.
You're more than welcome. No, thank you. This is great. This is great.
Thank you.